Hello everyone, my name is Monica Vu, and today I will be talking about anxiety. What is anxiety? Anxiety is feeling extremely worried or nervous more frequently or more intensely about things. So how does it affect our brain and body though? So low levels of serotonin are correlated to increased worry, obsessive and intrusive thoughts. Anxious moments does increase our adrenaline, but having too much though can lead to restlessness, rapid heartbeat, nausea, and muscle tension. When you do have anxiety, it does cause heightened stress. With stress, it affects our digestion, leading to stomach pain, also nausea as well, diarrhea, and IBS. When it comes to short and long-term health problems though, we do have respiratory problems, which it creates an unhealthy breathing pattern, gastrointestinal disorders, which leads to chronic digestion and excretory problems. For this one, it usually is for people who have generalized anxiety disorders, but it can impact your short-term or working memory. The last is muscle tension and chronic pain. This just comes from frequent distress signals that causes your muscles to contract and tighten. With having anxiety though, there's impact on behavior, decisions, and attitude. These are just a couple, but there are lots more. There's feeling irritable or being on edge frequently, trouble concentrating, feeling restless, trouble falling asleep, and just worrying excessively. Unfortunately, there are consequences. The most big one that I've seen is social isolation. This leads to avoiding social situations because fear of judgment. There's also just having difficulty in social situations. It has you avoid seeking help a lot. Your self-esteem is also lowered and having a risk of leading to depression. As for risk factors though, some risk factors include family history of anxiety, the use of alcohol or drugs, poor nutrition, just being in social situations, and also just a lack of access to support services. But as for protective, just being able to have like emotional self-regulation, good peer relationships, and also just a supportive relationship with your family. And lastly, just having the therapy and access to support services too is an important protective factor. Here are some resources at Cal State Long Beach that we do have if you guys didn't know about it. We have Beach Wellness, crisis mental health resource, which is available 24/7. You just have to text that number. Project Ocean, as well as counseling and psychological services. Thank you guys for listening. It is very important to watch out for your mental health, so please do keep track of that.